Welcome back to The Lead. I'm Shahan Ramkissoon. This is a special broadcast, of course, from Mitchell's Plain in the Western Cape, one of the areas of concern for the government here because of a rise in infections. As you know, President Cyril Ramaphosa putting Nelson Mandela Bay into stricter conditions going forward because of the increase there. But the Western Cape, despite concerns, not going into any other form of lockdown, localized neither. Let's continue the conversation in this province. We're joined by Sadiq Karim, Chief of Operations for the Western Cape Health Department. Sadiq, thanks for your time. We appreciate it. So, that's the one thing that newspapers have picked up on, that the Western Cape, even those so-called hotspot areas, are not getting any tougher restrictions. Are you confident that you have a control on things?
We are, as a health department, and in fact as a whole of government, we're confident we've got a control of things. We've got a very active containment strategy. As you know, and people would know, that we've had a fairly precipitous outbreak in the Garden Route. And in fact, the Garden Route's active cases has this week almost virtually double the active cases that they had at the peak. But that resurgence that we're having in the province is also, in fact, in areas such as this, where we're standing, in Mitchell's Plain. This area, over the week-on-week increase, has had a 53% increase, and right next door in Khayelitsha we've had a 63% increase week on week, and on average for the province a 43% increase. But from a health platform response, places such as this community health centre here and many others like this in the province, all the way to our hospital beds as well as our staffing and PPE capacity, we're confident that at this stage we have things under control.
Yeah. So why are you seeing dramatic increases in these densely populated areas?
Well, we think obviously with the advantage, the first surge that we had the advantage of lockdown. Now we don't. People are moving around quite freely, and as you can see, we're standing in the heart of Mitchell's Plain. There's a lot of activity, there's a lot of movement of people. But more concerning is the fact that people are not actually observing physical distancing. People are not wearing masks, and in fact people are not washing and sanitizing their hands. And what's even more concerning for us is the fact that people are gathering in large numbers. And we really want to stress that people should not be gathering in large numbers. We must be avoiding crowded places such as this, avoiding confined spaces, and in fact avoiding close contact.
Yeah. So let's talk about the Garden Route in particular as well. Many people expected some of those hotspots to be given stricter measures, but that didn't happen. In those areas where you see hospitals struggling, even in George, we spoke to our reporter Nadine Theron. She says that she's spoken to hospital officials. They are struggling to cope. Do you have enough capacity to make sure that people get the proper treatment if they do get infected?
Sure, we definitely feel at this stage that we have enough capacity in all our public hospitals, but remember we've also got a very large private hospital contingent in the province. So to give you some example, we had during December added 630 beds, general beds, to our public service platform, and in the Garden Route specifically we added just shy of 100 general beds as well as a quantum of critical care beds. And in the province we added another 135 critical care beds. But we also have the advantage in the province, after the first surge, we hadn't completely de-escalated. So in fact we kept our facility in Brackengate, which alone can take 336 patients. And then also we have other facilities where we have intermediate care patients in the province. From a staffing perspective, while we're under pressure, we're still confident at this stage we are managing and coping. We have redeployed staff, and that happened in George Hospital, as you've noted. But we've also got a very strong volunteer base. We've got agency staff, and we also have the Cuban doctors in the province still. And all of that combined, and we're hoping to add additional Cosmos, has given us enough staff.
And very quickly, the infection when it comes to healthcare workers, that's increasing here, isn't it?
Unfortunately, it is. And in fact, in George Hospital, as we speak, George Hospital unfortunately has the most healthcare worker infections right now. They've got 39 healthcare workers who've been infected. In total for the province, we've had just about 5,300 healthcare workers infected, and unfortunately 50 have already died. But George Hospital has 39, Tygerberg Hospital has a huge quantum, as well as Groote hospitals, roughly about 30 each of healthcare workers who are currently active and currently infected.
Yeah, I have to ask you this question because you will be criticized for it going forward. If you see a huge jump like you did initially, and we're seeing more and more deaths in this province, are you making the right move? Is this economy over lives?
It's a difficult balance, and I mean everybody would accept that it is a difficult balance. We, from the health platform and in fact whole of government, we are confident that we are managing this resurgence in the Western Cape, but at the same time, as you can see, people do have to have bread on the table, food on the table, so one has to have that, it's a difficult balance, one has to find that difficult balance. We believe we have it.
All right, thank you so much for your time, sir. Appreciate it. That is Sadiq Karim, Chief of Operations for the Western Cape Health Department. We'll give